5 Caffeine Withdrawal Signs to Cope. Hey there viewers, hope you'll be fine. Welcome to this video, where you will learn about the symptoms, signs of caffeine withdrawal. And here you'll also learn how to cope with the health issues. But before that, if you are new to here, then please subscribe to the channel, hit the nearby bell icon and make sure to choose All option, so that you never miss any latest upcoming video. Well guys, actually caffeine is a stimulant that works to improve alertness, wakefulness, and mood. People who regularly consume caffeine may experience withdrawal symptoms after they suddenly stop drinking it. Guys, this video will tell you the main symptoms of sudden caffeine withdrawal. It also discusses what caffeine withdrawal, and some tips on how to cope when reducing caffeine intake or quitting altogether. Please watch the full video for the complete detail. Let us get started. Number 1. Fatigue and weakness. Guys, many people are used to consuming caffeine in the morning time to boost their energy alertness levels against all-day planned work. It is sure that caffeine prevents fatigue and increases energy and alertness by blocking adenosine receptors in the brain. What is adenosine? Adenosine is a neurotransmitter that slows the central nervous system when the body prepares to sleep. However, when a person suddenly stops or reduces their caffeine intake, it can briefly have the opposite effect and make a person feel more tired and weak during the day. Number 2. Feelings of anxiety and nervousness. Guys, consumption of caffeine can change in mood and reduce feelings of anxiety and nervousness. These changes occur due to the effect that caffeine has on various neurotransmitters. These include dopamine, glutamate, and norepinephrine. Dopamine is one of the neurotransmitters that activate pleasure centers in the brain and plays a role in regulating emotions and behaviors. A 2015 study showed that caffeine does not directly stimulate dopamine production. Instead, it increases the number of available dopamine receptors in the brain. It may enhance dopamine's overall effect on the brain. Glutamate promotes communication among nerve cells and plays an essential role in learning and memory. Similarly, the brain produces norepinephrine when a person senses danger or stress in a process called the fight or flight response. Norepinephrine increases heart rate, breathing rate, and blood glucose levels. Guys, the sudden withdrawal of caffeine can cause a dramatic change in the chemicals present in the brain, which may cause feelings of anxiety, nervousness, depression, or irritability. Number 3. Affect concentration and memory. Well, guys, caffeine interacts with certain chemicals in the brain. It can directly affect concentration and memory. A 2019 study found that consuming just 80 mg/mg of caffeine led to improvements in working memory and reductions in response time among human participants. Similarly, findings from a 2016 study suggest that regular caffeine intake may lower the risk of dementia or cognitive impairment in women aged 65 years and older. People may experience difficulty concentrating after the sudden withdrawal of caffeine. In the absence of caffeine, adenosine molecules can promote feelings of fatigue that may affect a person's ability to concentrate. Number 4. Migraine and headache. Reducing or quitting caffeine after regular consumption can cause intense, migraine-like headaches in some people. As a fat and water-soluble molecule, caffeine readily crosses the blood-brain barrier where it constricts, or narrows, the blood vessels. Constricting the blood vessels causes a reduction in blood flow, which can help reduce migraine pain. Reducing or quitting caffeine will allow the blood vessels to grow suddenly, increasing blood flow. This dramatic increase in blood flow can cause painful, throbbing headaches similar to those of migraine. Headaches due to caffeine withdrawal can vary in length and severity. People can use caffeine to treat these headaches, but they should be careful not to consume more caffeine than they were previously. Number 5. Constipation. Caffeine stimulates contractions in the colon and intestines. These contractions help move food and waste material through the gastrointestinal tract. People who regularly consume caffeine may experience mild constipation after reducing their caffeine intake. People can prevent constipation issue by eating fiber-rich foods and staying hydrated. How to cope? Caffeine taker can prevent caffeine withdrawal symptoms by gradually reducing their caffeine intake over time. A 2019 study reported that gradual lowering in caffeine consumption over 6 weeks led to successful, long-term caffeine cessation with minimal side effects. To avoid or reduce caffeine withdrawal symptoms, you have to follow the upcoming steps. Number 1. Gradually reduce caffeine intake. Quitting caffeine can cause dramatic changes to brain chemistry, which may affect a person's mood, cognitive ability, and physical well-being. Number 2. Find caffeine replacements. People who drink regular coffee can gradually reduce their caffeine intake by mixing a little decaf into their daily coffee. People who drink multiple cups of coffee can try replacing one or more with decaf. Number 3. Get sound sleep. Getting enough sleep will help to fight fatigue. Feeling well rested can help reduce the body's dependence on caffeine. Number 4. Drink plenty of water. Staying hydrated is essential. Dehydration can lead to headaches and fatigue. It is all about guys. You should reduce caffeine intake gradually, and find a better replacement to avoid the health issues. I hope you liked the video. Please hit like button, share with your friends and subscribe to the channel for more videos. Thanks for watching.